Assalamualaikum everyone. Today our team is excited to present on the topic of medical ultrasound imaging to explore how sound waves allow us to see inside the human body in real time. So before we dive into the technology, allow me to introduce my group members first. Firstly, we have Yasmin. Second is me, myself, Balkis. Third is Rashika. Fourth is Ain Salwani. And lastly, we have Aina. Today, we'll begin our presentation with the introduction of ultrasound. So basically, what does ultrasound means? So ultrasound refers to a sound wave with frequency higher than the upper audible limit of human hearing, typically starting at 20,000 Hz. This is because ultrasound waves have shorter wavelength than the audible sound, making they can be reflected off small objects or focused into narrow beams. Basically, this unique physical property makes them incredibly versatile tools across medicine, engineering, and oceanography. Moving on is the significance of ultrasound in medical imaging through four key advantages. Firstly, we have safety and non-ionizing radiation. So, ultrasound uses high-frequency sound wave instead of harmful radiation. This is because it carries no long-term health risk, so it remains the safest imaging choice for monitoring fetal development and perform repeated diagnostic scans. Second, we have real-time dynamic imaging. So it means that it captures live, moving visuals rather than static snapshots. This allows doctors to monitor active blood flow in real time and safely guide precise procedures like needle biopsies. And third, we have non-invasive patient comfort. So, ultrasound prioritizes patient comfort. The procedure is non-invasive, requiring only a topical gel and a surface probe. This eliminates incisions, recovery time, and the claustrophobia common with enclosed scanner. So last but not least, we have portability and cost effectiveness. Ultrasound equipment is compact and highly cost effective compared to CT scan and MRI scanner. Its mobility allows for immediate and bedside diagnostic in emergency room and remote clinics.
Next, I will explain the scientific instrumentation used in ultrasound imaging. First, we have generator, also known as the pulse. Its function to produce electrical pulse that power the ultrasound system, and then these pulses are sent to the transducer. Next is the transducer, which is one of the most important components. It converts the electrical pulse into ultrasound wave that travel into the body. When wave hit the tissue or organs, echoes reflected back and received by the same transducer. Then the received echoes are sent to the signal processor. Signal processor analyze and process these echoes to calculate their intensity and position and form them into a meaningful image. Finally, the processed image is displayed on the monitor. The monitor allows healthcare professionals to view the internal structure of the body in real time for diagnosis and examination. On this slide, I will explain the application concept. There are three main displays, which are A mode, B mode, and M mode. First, A mode stands for amplitude mode. It is 1D display where echoes are shown as spikes. The height each spike represents the strength of the reflection signal. The strongest reflection signal from tissue interface produce higher amplitude. The image consists of two axes, which are amplitude and depth. The A mode commonly used for measure eyeball. Next, for B mode stands for brightness mode. In this mode, the echoes are displayed as dots on the screen. The brightness of each dot depends on the intensity of the reflected echoes. Stronger echoes appear brighter and the weaker echoes appear darker. B mode is used to produce 2D grayscale image and is the most common mode used in medical ultrasound today. Lastly, for M mode stands for motion mode. It is used to trace and analyze the movement of body structure. This mode is commonly used in cardiac ultrasound to observe heart motion and fetal heart activity. A single ultrasound beam is transmitted and the reflected echoes are displayed continuously over time.
Ultrasound imaging is a technique that uses high-frequency sound waves to produce images of structures inside the body. It is commonly used to examine organs, soft tissues, and to monitor a baby's development during pregnancy. The process starts with a device called a transducer. This transducer sends out waves into the body. When the waves hit different tissues or organs, they bounce back as echoes. These echoes are received by the transducer and sent to a computer. The computer processes the information and creates an image that appears on the monitor in real time. One of the biggest advantages of ultrasound is that it is non-invasive and does not use ionizing radiation, making it a safe and widely used imaging method. An ultrasound system consists of several key components that work together to produce images. The first component is the transducer probe. It sends ultrasound waves into the body and receives the returning echoes. Inside the probe are piezoelectric crystals, which are responsible for generating and detecting the sound waves. Next is the CPU, or Central Processing Unit. Its role is to process the echo signals and convert them into images that can be interpreted by healthcare professionals. The images are then displayed on the monitor in real time, allowing doctors to observe internal structures immediately. Another important component is the ultrasound gel. This gel removes any air between the probe and the skin, allowing the sound waves to travel more effectively into the body. The piezoelectric effect is the principle that makes ultrasound imaging possible. Inside the transducer are piezoelectric crystals. When electrical signal is applied, these crystals vibrate and produce ultrasound waves. Then the echoes return from the body and crystal convert those vibrations back into electrical signals, which then produce to form an image. Another important application of ultrasound is Doppler ultrasound. Unlike regular ultrasound, Doppler ultrasound is used to measure blood flow. It works by detecting changes in the frequency of the reflected sound waves as blood cells move through blood vessels. This allows doctors to determine the speed and direction of blood flow. As a result, Doppler ultrasound is very useful for identifying problems such as blocked or narrowed blood vessels and monitoring overall blood circulation. In conclusion, ultrasound is a safe and effective imaging technology that combines sound waves, piezoelectric crystals, and computer processing to help doctors diagnose and monitor various medical conditions.
After understanding how ultrasound works, let's explore its real-world implementation. Due to its ability to produce real-time image without using ionizing radiation, ultrasound has become an essential diagnostics tool in many medical specialties. Let's begin with nephrology, which focuses on the kidney. Ultrasound is used to detect kidney stones and identify their size and location. A renal lithotripsy using ultrasonic wave to break kidney stones from larger to smaller fragments. This process is called lithotripsy. Moving on to the musculoskeletal imaging, ultrasound allows doctors to see blood vessels, muscle, and joints inside the body. It is used to treat soft tissue ailments, bursitis, collagen disease, and soft tissue injuries. Decreasing pain and reducing soft tissue stiffness results in a shorter healing time. Another important implementation is veterinary medicine. Ultrasound is widely used to examine animals. It can help detect foreign objects that a pet has swallowed, assess the damage they might cause, and monitor pregnancy or internal organ health. Finally, cardiology uses ultrasound techniques like Doppler and 4D ultrasound to diagnose any heart disease in a patient. It helps doctors diagnose heart disease by showing the heart structure, blood flow, valve function, and the condition of the surrounding tissue.
I will be discussing the potential benefits and challenges of ultrasound imaging. Besides diagnosis, ultrasound is increasingly being used to support advanced treatment. One important example is high-intensity focused ultrasound or HIFU, which can destroy target tissue without the need of the surgery. Ultrasound can also enhance drug delivery by helping medication reach a specific area more effectively. In addition, it has shown potential in tumor treatment and blood clot breakdown, making it a valuable tool in modern medicine. Ultrasound is also useful in the treatment of infection and disease. It helps healthcare professionals quickly and safely detect superficial deep neck infection. Because it provides real-time imaging, doctors can use it to guide diagnosis and procedures such as needle aspiration. Furthermore, ultrasound is portable and non-ionizing, allowing it to be used at the patient bedside for early airway assessment and monitoring. Another emerging application is in cancer immunotherapy. Research shows that ultrasound can enhance the effectiveness of immunotherapy by strengthening the body's immune response against cancer cells. It improves treatment delivery, increases tumor targeting, and can transfer immune-resistant tumor into immune-reactive tumor. Ultrasound also enables non-invasive tumor destruction while stimulating immune activation, which may improve treatment outcome for the cancer patient. Despite this advantage, ultrasound imaging has also several challenges. One challenge is limited penetration through thick tissue. Ultrasound wave may struggle to pass through thick layer of tissue, resulting in reduced image quality, especially patients with higher body fat percentage. Another challenge is the difficulty of imaging deep organs. Organs such as liver may be located several centimeters beneath the skin surface, making it harder to obtain clear and accurate image. As a result, diagnostic accuracy may sometimes be affected. Finally, there is the issue of reduced image resolution. To image deeper structure, lower frequency probes are often required because they can penetrate further into the body. However, lower frequency produce image with less detail and lower resolution, which can limit the visualization of the small structure.
Advances in technology are making ultrasound more accurate, faster, and easier to use. Let's look at the future developments. These are advancements that aim to improve the performance and effectiveness of ultrasound technology. The first future development is fusion imaging. This technology combines ultrasound with other imaging methods such as CT or MRI scan. By combining this image, doctor can obtain a more accurate view of the body, leading to better diagnosis, improved treatment planning, and safer medical procedures. Another important development is AI-driven ultrasound. Artificial intelligence helps optimize image quality and automatically identifies important features. It can also help clinicians prioritize urgent cases, making diagnosis faster and improving workflow in hospitals. Moving on to the innovation, these technologies introduce new ways of using ultrasound to improve imaging quality and diagnostic accuracy. The first innovation is 3D and 4D ultrasound. Unlike traditional 2D ultrasound, 3D ultrasound produces detailed 3-dimensional image, while 4D ultrasound displays this image in real time. This allows doctors to examine complex anatomical structures more clearly and especially valuable in obstetrics, cardiology, and fetal development monitoring. Another major innovation is the integration of artificial intelligence into ultrasound imaging. AI assists healthcare professionals by analyzing ultrasound image, identify potential abnormalities, and improving diagnostic accuracy. It also reduces operator dependence, making examination more consistent and efficient while allowing clinicians to focus on patient care.
It seems like we have reached the end of our presentation. So to conclude, medical ultrasound imaging utilizes high-frequency sound wave to provide safe, real-time diagnostic visualization across key clinical areas like obstetrics and cardiology. While the technology offers vast benefits like being radiation-free, it faces limitations regarding operator dependency and dense tissue penetration. Ultimately, it stands as an irreplaceable, highly efficient tool that continues to play a vital role in patient care.